Everyone, and welcome to today's CoreVantage webinar. It's titled Pregnancy and Gestational Diabetes, What Every Expecting Mom Should Know. My name is Samantha Jaworski. I'm one of the dietitians. I'm also a certified diabetes care and education specialist here at GemCare Wellness. Pregnancy is such an exciting and special time, but for many moms to be, it can also feel overwhelming when health challenges arise. One of the most common is gestational diabetes. If you've just been diagnosed, or if you're trying to learn more, you might be feeling worried about what this means for you and your baby. And here's the truth. With the right knowledge, tools, and support, you can manage gestational diabetes successfully. Most women go on to have a healthy pregnancy and healthy baby. So today we're going to simplify the science, give you practical tips, and help you feel confident and in control of your health during this important journey. Here's a roadmap for today. First, we'll talk about what gestational diabetes actually is, because understanding the why behind it helps to reduce fear and guilt. Then we'll look at who's at risk and how doctors diagnose it. From there, we'll dive into the most practical parts: nutrition strategies, lifestyle changes, and blood sugar monitoring, because those are things you can start applying right away. We'll also discuss treatment options, because sometimes diet and activity aren't enough on their own, and that's okay. Finally, we'll wrap up with what to expect around delivery and postpartum care, since your health journey doesn't stop after birth. My goal for you is to leave today's session feeling informed, reassured, and ready with practical tools. So what is gestational diabetes? This is diabetes that's first diagnosed during pregnancy, usually between the weeks of 24 and 28 weeks gestation. During pregnancy, your placenta produces hormones that support your baby's growth. But these same hormones can also make your body more resistant to insulin. Insulin is what helps your body move sugar from your bloodstream into your cells for energy. When resistance gets too high, your blood sugar levels end up rising. That's when we start to see gestational diabetes. You might be surprised to learn that this happens in about 6 to 9% of all pregnancies in the US. That means you are definitely not alone if you've been diagnosed with this. And importantly, gestational diabetes usually goes away after delivery because those pregnancy hormones are no longer in play. So while it's not something to ignore, it's also not a reason to panic. With good management, most moms and babies do very well. With that said, you may be wondering, how can gestational diabetes affect my baby? Studies have shown that you can have a healthy baby if your blood glucose, which is your blood sugar levels, are in your target range. But if your blood sugars stay high during pregnancy, babies can end up growing too large, making a vaginal delivery more difficult. In addition, they can have some health problems at birth, such as breathing problems or blood glucose levels that are too low. That's called hypoglycemia. They can also have other conditions such as low levels of calcium in the blood, jaundice, which is yellowing of the skin, and an abnormal increase in red blood cells. Your healthcare team will monitor your baby for these health problems after delivery. Some women wonder, why me? The reality is anyone can develop gestational diabetes, but certain risk factors make it more likely to happen. These include having a family history of diabetes, a history of high blood pressure, being overweight before pregnancy, being over the age of 25, having had gestational diabetes in a previous pregnancy, and even your physical activity status can play a role in whether you may develop this or not. Certain ethnic backgrounds also carry a higher risk. With that said, plenty of women with zero risk factors still develop it, and many with multiple risk factors never do. So this isn't about blame, it's about biology and hormones. Screening usually happens between 24 and 28 weeks of pregnancy. However, if your provider thinks you're at a higher risk, they may test earlier, usually around 16 weeks. The test that is used is called a glucose tolerance test, and this is where you drink a sugary drink and your blood sugar levels are measured afterward. Remember, a diagnosis doesn't mean that you failed in any way. It just means your care team now has important information to guide the healthiest pregnancy possible. You may be wondering why the glucose tolerance test is used and not a A1C blood test, which is typically what is used to diagnose diabetes. The glucose tolerance test is used in pregnancy due to physiological increases in red blood cell turnover. That high turnover of red blood cells is the reason we don't use the A1C test, because A1C levels end up falling during a normal pregnancy. So it's not a good diagnostic indicator of gestational diabetes. Additionally, A1C may not fully capture postprandial hyperglycemia. That's your post-meal high blood sugars. Those high blood sugars after a meal are what really drives what's called macrosomia. That's a large birth weight baby. So the glucose tolerance test is really good because it's showing how well your body can handle a high amount of carbohydrate at once. With that said, A1C is still useful throughout the pregnancy and is often checked throughout. The goal for A1C during pregnancy is for it to be less than 6%. The general non-pregnant population goal is typically less than 7%. So it is a little lower in pregnancy at less than 6%. And it should only be used as a secondary measure of glycemic control in pregnancy after self-monitoring of blood glucose. For the glucose tolerance test, you consume a sugary drink, and then your sugar is tested in intervals of 1 hour up to 3 hours, typically, depending on how the test is ordered by your doctor. The glucose tolerance test is indicated, like we talked about, in pregnancy. It may also be used in someone who has anemia, someone that may have recurrent blood loss, or recently received a blood transfusion. There are basic nutrition and lifestyle strategies that can be used to help manage gestational diabetes, and you will definitely work with your healthcare provider and dietitian on more specific strategies. But to provide a basic overview, balanced meals, which includes a protein, fiber, and healthy carbs, is important. And we'll look at an example on the next slide. Eating smaller, more frequent meals may be a little better for your blood sugars. Gentle movement after meals, such as walking and stretching. Some activity tips. You want to aim to be active for 30 minutes a day, 5 days a week, or 150 minutes per week total of exercise. And you can spread that out however you like. Definitely work with your doctor to determine what activity you're cleared for. Typically, what you were doing pre-pregnancy is safe to do throughout the pregnancy, but you do always want to ask your doctor and get the clearance from them. And then even getting up and stretching for a few minutes for every 30 minutes that you're sitting still can help just add extra movement into your day. And hydration, drinking plenty of water, and rest matter too. So here is a example plate. This is the diabetes plate, and it provides a visual guide of what you can eat at each meal and snack. It offers a way to make sure you have healthy carbohydrates, lean protein, fiber, and good fats at each time that you eat. The diabetes plate can be a starting point you can use throughout your pregnancy, after delivery, and while breastfeeding. And again, you should work with your dietitian to make sure your eating plan is meeting your specific needs, depending where you are at. in your pregnancy or postpartum journey. Some healthy eating tips. Eat 3 smaller meals and 2 to 3 snacks at about the same time every day. Include carbohydrates and protein in meals and snacks. Add non-starchy vegetables to meals whenever possible. Keep the amount of carbohydrate content at breakfast lower than the rest of the day. So you want to aim for about 30 grams of carbohydrate or less. And again, if you're wondering what 30 grams is, that would be a great question to work with your dietitian on. And carbohydrates at breakfast often have a higher impact on your blood glucose levels. So that's why the lower carbs at breakfast may help combat that. Choose foods that are a good source of fiber, including whole grains, beans, vegetables, and fruit. If you're feeling extra hungry, adding some non-starchy vegetables as desired. Some examples would be celery, lettuce, broccoli, cauliflower, asparagus, tomatoes. In that picture, you can see cucumber, red onion, and avocado. Avocado is also a great healthy fat to include at your meals, and that'll also help you feel full as well and help with blood sugar spikes. If you are feeling nauseous at meal times, definitely speak with your healthcare provider about the best options for treatment. Also important to drink plenty of water and non-caffeinated 0-calorie drinks. And you want to limit sweet foods and drinks and the use of sweeteners, including sugar, honey, syrup, agave, and regular soda as much as possible. You can use non-nutritive sweeteners such as Equal or Splenda in moderation. Limit caffeine to 200 milligrams per day. So that comes down to about cup and a half of coffee. So blood sugar monitoring can feel intimidating at first. This is where you're checking your blood sugar yourself, but it quickly becomes part of your daily routine. Most women are asked to check about 4 times a day, first thing in the morning, before eating, and then 1 to 2 hours after meals. At first, you might worry about the numbers, whether they're good or bad, but here's the key. These numbers are not a grade, they're just information. They help you and your provider see what is working and where adjustments might be needed. You could think of it like a GPS for your health. If you take a wrong turn, the GPS doesn't shame you, it just reroutes. CGMs are also becoming more widely used in gestational diabetes, which would save you from having to do so many finger pricks each day. So you could definitely ask your healthcare team or healthcare provider if this may be an option for you. CGMs are typically worn on the arm, and as their name indicates, they are continually monitoring your blood glucose levels so that you can see them on your app, on your phone, or using the CGM reader. You may be wondering, what should my numbers be? You will work with your care team on your specific goals, but some typical recommendations as recommended by the American Diabetes Association, we're looking for fasting glucose 95 or lower, 1 hour post-meal blood sugar 140 or lower. And if you're looking 2 hours after a meal, we want to see about 120 or lower at that time. Sometimes, despite your best efforts with food and activity, blood sugar levels still run high. That's not because you're doing anything wrong, it's because pregnancy hormones can be powerful. If that happens, your provider may recommend medication. Insulin is the most common and is considered completely safe for pregnancy. It does not cross the placenta to your baby. In some cases, oral medications may also be used. It's really important to remember needing medication is not a sign of failure or severity. It's simply one more tool to keep your baby safe and your pregnancy on track. Many women use insulin for just a short time and return to normal blood sugars once the pregnancy is over. So, what can you expect after delivery? Your baby's blood glucose will be monitored right after delivery. Your baby may need to go to the special care nursery for observation if their blood glucose levels are too low. It's important that you have your blood glucose monitored at 6 weeks after delivery. You have a high chance of having gestational diabetes in future pregnancies and getting type 2 diabetes later in life. So, postpartum, continue eating healthy and increase your physical activity after delivery, as your provider clears you to do so. And if you're overweight, losing a modest amount of weight, like around 5 to 7% of your total body weight, that can also help you to reduce your risk of developing type 2 diabetes later down the road. Your healthcare provider will likely ask to schedule a test for type 2 diabetes 4 to 12 weeks after your delivery. Managing gestational diabetes isn't something you need to do alone. Your healthcare team, your OB, your diabetes educator, dietitian are all there to guide you every step of the way. But don't forget the role of your family. Something as simple as preparing balanced meals together or joining you for a walk after dinner can make your journey much easier and much more enjoyable. And of course, we at Edwards Healthcare Services and through our CoreVantage program are here to support you beyond just medical supplies. We're committed to education, resources, and encouragement to help you feel confident, not just during pregnancy, but after. As we wrap up, I want to leave you with some key takeaway messages. First, gestational diabetes is common and manageable. You are not alone in this. Secondly, small daily choices such as balanced meals, gentle activity, regular blood sugar monitoring all make a big difference. Third, if medication is needed, it's safe and effective. And finally, don't forget about yourself after pregnancy. Caring for your health postpartum sets you and your family up for a healthier future. Thank you for spending this time with us today, and we'll now open the floor up to questions. All right, so I do see a few questions that did come through here. The first one that came through, did I cause my gestational diabetes? Definitely not. Hopefully you did hear that throughout this presentation. It is caused by pregnancy hormones, and those increase insulin resistance. So many women with no risk factors can develop gestational diabetes. It's definitely not your fault. Again, it's those pregnancy hormones that you really have no control over that can cause those issues. Another question that came through, will my baby have diabetes because I had gestational diabetes? That's a really good question. Not necessarily. Most babies are completely healthy. Good blood sugar management during pregnancy really helps to reduce the risk of your baby developing diabetes in their lifetime. Another question I see, if I need insulin, does that mean my case is severe? No. And hopefully you heard that through the presentation too. Sometimes those hormones, especially as you get towards the end of your pregnancy, can make it really challenging to control your blood sugars with diet and exercise alone. So insulin is another tool that your healthcare team can use to help keep you and your baby safe and your blood sugars well controlled. Okay, and the last question I see, what should I do after pregnancy? So again, you want to get screened at your postpartum visit or ask your doctor about getting screened, and keep up with those healthy habits we mentioned with the movement, those diet strategies we talked about. And just keep in mind that having gestational diabetes does raise your risk of type 2 later in the future. So definitely stay proactive, keep getting screened. Ask your doctor how often you should be screened. They may want to screen you once a year for type 2 diabetes. And that's all I see for questions. Here's the list of references here. And thank you so much for joining today. I really enjoyed presenting for you.